Good day, everyone. I am Ana Maris Briones, a student nurse from Davao Doctors College, and today I'm going to perform parenteral drug administration using subcutaneous and intramuscular injection. Prior to the conduct of procedure, the first thing to do is to check the doctor's order on the patient's medication administration record. This is to identify what drug is to be given to the patient, the drug name, the dosage, the route of administration, and the time it is to be given. After that, perform hand hygiene to prevent the spread of microorganisms and to avoid the cross-contamination. The first procedure is the subcutaneous injection. So the subcutaneous injection is the introduction of a small amount of solution by means of the syringe and needle into the adipose tissue beneath the skin. The first thing to do is to read the doctor's order and compare the medication in hand. Okay, it is the same. Next, perform hand hygiene to prevent cross-contamination. Next, we'll also have to prepare the equipments and the medications needed for the subcutaneous injection. Now, to prepare the medication for the subcutaneous injection, we'll have an insulin syringe. The next, open the sterile cup and then take out the insulin syringe and then uncap the syringe and then draw into the syringe draw air just with the correct amount of the medication prescribed by the doctor. Then inject the air into the vial. And then invert the vial and draw the medication up to the exact amount needed. Now, there is no bubbles. You need to cup it and place it on a hypodermic tray. And then write the drug name, the dosage into the medication ticket. And place it also into the hypodermic tray. Okay, the first thing to do is to check the doctor's order in the patient's chart and also introduce yourself to the patient and verify the patient's identity and explain the procedure. So good morning, ma'am. I am Ana Maris Briones, a student nurse for today. So may I see your wristband, please? Can you state your name, please?
I'm Ali Briones,
Your age,
19 years
your birth date.
April.
Okay, ma'am. Today I will be doing the subcutaneous insulin, and I will inject you insulin in this part of your abdomen. Insulin is to control your blood sugar since you have type 1 diabetes. Will that be alright, ma'am?
Yes.
And then perform hand hygiene and observe appropriate infection prevention procedures. And then arrange the medication cart on a hypodermic tray with a corresponding drug. Now determine which site will be used and expose the potential injection site. Now inspect any bruising or any inflammation. Best side could be the outer aspect of the upper arm, the abdomen just below the costal margin to iliac crest, and the interior aspect of the upper thigh. And palpate the site and avoid any area that is tender. Okay, ma'am. Are you feeling pain in your abdomen? No. Okay. To make sure that you have a right size needle, use your thumb and forefinger to grasp the skin fold of the tissue. And measure the fold from top to bottom to ensure that the needle is halfway long. We now place the patient into the comfortable position and now apply the clean gloves. Now use an antiseptic swab to clean the site and in circular motion, starting at the center, circling outward. Pull the needle cup and hold the syringe between the thumb and the forefinger of your dominant hand, and as if you're holding a dart. Now insert the needle quickly and firmly at 45 to 90-degree angle. And then pain is minimized by inserting the needle without hesitation. And then release the pinched skin and then rest the non-dominant hand on the patient and move the dominant hand on the end of the plunger. And slowly inject the medication over several seconds. And then retain the grasp on the syringe to keep it still. Now quickly withdraw the needle and place a swab and apply gentle. But don't massage the area. Now place the patient in a comfortable position and document the procedure. The next procedure is the intramuscular injection. So the intramuscular injection is the introduction of medication deep into the muscle tissue where a large network of the blood vessels can absorb it readily and quickly. The preparation of intramuscular injection medication. So the doctor ordered 5 milligrams of morphine sulfate to address the pain of a patient sustained from the car accident, which may cause her pain and injury at her right arm. Before we could draw the medication from this vial, we need to do first mathematical calculation of the dosage needed. So the doctor ordered 5 milligrams of 5 milligrams of morphine sulfate. Now that we have the exact dosage needed, we can now draw the medication to the medication vial, and of course we need a syringe with the gauge 23 needle, and let us open this. Always remember that we can only touch the barrel and the plunger of the syringe, and I'll have to separate first so that I can connect the syringe into a aspiring needle to draw the medication. Now connect the syringe into the aspirating needle. Be sure that the connection isn't loose to avoid injuries. Now we can open the medication vial. We should clean its surface with a cotton that has been soaked in a 70% alcohol. So do this at least 30 seconds. Now take the syringe and uncap it. And then draw air into the syringe. The air to be drawn inside would be equal to the amount of the medication needed prescribed by the doctor. Now inject the air into the vial. Invert the vial and draw the exact medication needed. Then remove the aspirating needle and replace it with the H23 needle that will be used in an actual administration of this intramuscular injection. Now place this syringe into hypodermic tray. And then write the medication, ticket, the name of the drug, and the dosage, of course. And place it also in a hypodermic tray. Okay, the first thing to do is to check the doctor's order in the patient's chart, and also introduce yourself to the patient and verify the patient's identity and explain the procedure. So good morning, ma'am. I'm Ana Maris Brianas, a student nurse for today. So may I see your wristband, please? Can you state your name, please?
I'm Ali Prince.
Your age,
19 years.
your birth date.
April.
Okay, ma'am, your doctor, Dr. Smith, prescribed you morphine sulfate to alleviate your feeling of pain, okay? Select appropriate site for injection: vastus, lateralis, and deltoid muscle of possible site. For intramuscular injection, examine the integrity and amount of patient's muscle mass and palpate the muscle area. Inspect the area for bruising and inflammation and edema. So my patient is in a side-lying position. Apply gloves and anatomic landmarks. Place the heel of the hand over the greater trochanter of the patient's hip with the wrist almost perpendicular to the femur, and then point the thumb towards the patient's groin. Point the index finger to the interior superior iliac spine, and extend the middle finger back along the iliac crest towards the bottoms. The injection site is the center of the triangle. Disinfect the injection site in a circular pattern from inner to outer for about 2 inches. Hold the ghost pad between the third and fourth finger of the non-dominant hand, and then uncap the syringe and hold the syringe between the thumb and the forefinger and the dominant hand as if holding a dart. Place your ulnar side of your non-dominant hand just below of the injection site and hold the patient's skin laterally about 1 to 1.5 inches. Hold the position until you inserted the needle. Then aspirate the syringe by pulling back the plunger with your dominant hand. This is to determine if you had hit a blood vessel. If blood appears, it means you have hit a blood vessel. Then remove the needle and syringe and start over. Inject the medication slowly at the rate of 1 ml and 10 seconds and smoothly withdraw the needle. Release the skin and place the swab over the injection site. And apply gentle pressure but do not massage the area. Okay, ma'am, we're done now with the intramuscular injection, and I am going to head out now so that you can have some rest, and please don't massage the injected area, okay? Now, since my patient is in a comfortable position, and now document the procedure.